So, post-traumatic stress disorder (PTSD). It is a familiar topic. We know about what these conditions and all. And now I'll be talking about how to write this as a 4-marker in our university examinations. And in this module, I have taken my points from Mandapa, Manipal Exam Preparatory Manual for Medicine. So let's see what all you have to write if PTSD as a 4-marker. It is recurring intrusive recollection of an overwhelming traumatic event. Recurring intrusive recollection of an overwhelming traumatic event. What all can be the traumatic events? For example, rape, severe burns, accidents, military combat, etc. So these are the examples of some traumatic events. There are more and more depending upon the person. So it is recurring intrusive recollection of an overwhelming traumatic event, and the recollections will be lasting for more than 1 month, and this PTSD will begin within 6 months of the traumatic event, and women are more affected than men. So these points you have to write while typing the definition part. It is recurring intrusive recollection of an overwhelming traumatic event. Examples: rape, severe burn, accidents, military combat, etc. And these recollections will last for more than 1 month and begin within 6 months of the event, and women are more affected than men. Coming to the etiology and pathophysiology, you can remember this one as a flowchart. The first main important one is excessive release of norepinephrine from the locus coeruleus. This locus coeruleus is the part of the brain from which the norepinephrine is released. So there is excessive release of this norepinephrine from the locus coeruleus in response to stress. If excessive stress is there, from the locus coeruleus, norepinephrine will be released. Excessive release of norepinephrine from the locus coeruleus in response to the stress. That is the first point. Second one, due to this excessive release, there is increased noradrenergic activity, where at the projection sites in hippocampus and amygdala. In hippocampus and amygdala, the projection sites, there is increased noradrenergic activity due to excessive release of this norepinephrine from the locus coeruleus in response to stress. So these 3 points is very clear. There is excessive release of norepinephrine from the locus coeruleus in response to the stress, and there will be increased noradrenergic activity at the projection sites in the hippocampus and amygdala. And these changes will facilitate the encoding of fear-based memories. You have to draw this as a flowchart. First one is excessive release of norepinephrine from the locus coeruleus in response to the stress, and there is increased adrenergic activity at projection site in the hippocampus and amygdala, and these changes will facilitate the encoding for the fear-based memories. Next one, what are the risk factors? The risk factors for the development of the PTSD include a past psychiatric history. If the person is having any past psychiatric history, he is predisposing for the condition for developing the PTSD. And the personality characteristic of high neuroticism. Neuroticism means a person he is very shy, and he won't show his emotions outside. Like even if it is anger, whatever it is, he won't show it outside. And extroversion, the person is who is so much talkative, and also the risk factors for developing PTSD include any past psychiatric history and the personality characteristics of high neuroticism and extroversion, and also some genetic influence is also present in PTSD. So I think etiology and pathophysiology is clear for you guys. Now let's move on. What are the clinical features? This PTSD usually starts after few days or months after the traumatic event. So we told within 6 months it will develop. So the PTSD usually starts after few days or few months after the traumatic event, and generally events likely to evoke PTSD are those that invoke feelings of fear, helplessness, or horror. Typical symptoms are recurrent intrusive memories of the traumatic events, flashbacks we will say, as well as sleep disturbances, insomnia will be there, and nightmares will be there. So typical symptoms, what are they? Flashback, that is recurrent intrusive memories of the traumatic events, as well as the sleep disturbance will be there, and nightmares will be there. The patients often actively avoid the stimuli that precipitate the recollection of the trauma. The patient don't want to talk about the incident again, because that will again cause the stimulus to precipitate the recollection of the past trauma. So the patient will be doing that. He will be actively avoiding the stimuli. These patients are at risk of developing other disorders that is related to anxiety, mood, and substance abuse. So these patients are at a very high risk for developing other disorders. What are they? Like the disorders that are related to anxiety, mood, and substance abuse. Coming to the management part, the most important management part is psychotherapy, and it involves exposure therapy. What is this exposure therapy? The person is exposed to the situation which he avoids. Like he will be actively avoiding the situation that he will be remembering about the past trauma. So we have to repeatedly expose the patient to the fantasy. Like repeated exposure in fantasy to the traumatic experience will itself usually lessens the distress. At first there will be initial distress will be there, but if you are continuously exposing the patient to the same incident, gradually the effect will be lessened. So that is good for that is the first important therapy that we are giving for the post traumatic stress disorder patients. Psychotherapy involving exposure therapy. I guess it's clear. Like we will be exposing the patient to the similar environment again and again. So after in a long term, he will be okay with that situation. The second one is selective serotonin reuptake inhibitors, SSRI. Example, sertraline. Sertraline. It's an example for SSRI. It is also effective in PTSD patients. And the most patients will be recovering within 2 years. So that is the short simplified explanation for the PTSD condition. The main important thing is the definition part. What is this PTSD and what are the etiology and what is the pathophysiology in this condition that I have explained. As a flowchart, you have to explain this, and then you can mention about clinical features. The investigation part, it is actually a clinical diagnosis. So with these symptoms and all, we can diagnose the condition. And what are the clinical features that you have to mention? Repeated flashbacks will be there, the sleep will be disturbed, nightmares will be there. The patient often actively avoid the stimuli that precipitate the recollection of that older trauma. And these patients, and keep in mind, these patients are very at high risk of developing other disorders like anxiety, mood and substance abuse. And management is psychotherapy. That is main therapy is exposure therapy. We have to expose the person again and again to the similar environment, and at initially he will be having very severe distress, but after some time he will be okay, and the experience will be good in the long term. And selective serotonin reuptake inhibitors we can give to the patient, example sertraline, and most patients will be recovering within 2 years. And you have to write minimum this much if it is asked as a 4 marker.